Hello all. Today is the today's lecture is about the last part of the topic autopsy. In this lecture, you will be learning about the preservation and dispatch of viscera, how you determine the cause of death after doing autopsy, then an interesting topic about virtual autopsy, forensic anthropology, and lastly about exhumation. Preservation of viscera is done after autopsy in all cases of homicide, death due to suspected poisoning, obscured autopsy, death due to hanging or drowning, death due to burns, and sudden and suspicious death. So, in all of these cases, preservation of viscera is done as a routine procedure. What are all the viscera that are being preserved? The whole stomach and its contents. Liver, a minimum of 500 grams is required. And in case of children, whole liver is preserved. Half of each kidney in case of adults and both kidneys in case of infants. If we suspect the presence of vegetable poisons, a portion of small intestine about 3 feet in adults, 5 feet in children, and whole of small intestine in infants are to be preserved. If we suspect the presence of volatile poisons, then a portion of lungs have to be preserved. If we suspect the presence of a cerebral poison or a spinal poison, a portion of brain or spinal cord, about 300 grams, may be preserved. Spleen, half in adults and whole in infants, and then blood and urine, blood about 10 ml or more in separate vials, then urine about 30 ml. Now regarding the containers, usually glass bottles are used for preservation of viscera, which is having 1 liter capacity, and it should be clean, wide mouth, white, and fitted with glass chopper. So this is the criteria for glass bottle. It should be having a 1 liter capacity, then should be clean, wide mouth, white, and fitted with glass choppers. And these glass containers should be cleaned with H2SO4 chromate solution, and it should be rinsed with distilled water and air dried. Sometimes polyethylene bags or polyethylene containers can be used, but it should not be used in case of volatile poison, because the volatile poison may diffuse through the plastic containers. And if lungs or other tissues are to be preserved, it should be preserved preferably in nylon bags. And the blood should be collected in screw capped bottle of about 30 ml. Now regarding the preservatives that are used to preserve the viscera. Commonly, saturated solution of common salt is used, and the contraindication for the use of saturated solution of common salt is in poisoning with mineral acids, alkalis, metallic poisons, and aconite. The most important or the most preferable preservative is rectified spirit, and the contraindication for the use of rectified spirit is in the use of poisoning by alcohol, acetic acid, phenol, paraldehyde, and phosphorus. If we preserve the viscera of a phosphorus poisoning case in rectified spirit, it is more likely that the photoluminescent property of the vomitus and feces and the viscera will be vanished from the specimen. So it will be difficult to detect the presence of phosphorus. And in case of urine, 1 ml of concentrated hydrochloric acid or 100 milligram of thymol or 100 milligram of sodium fluoride can be used for every 10 ml of urine as preservative. In apart from this, toluene is the better preservative for preserving urine. Contraindication for a preservative is formaldehyde, then because formaldehyde, if the viscera are preserved in formaldehyde, extraction of poisons will become difficult for the chemical examiners. And for blood grouping and DNA profiling, a piece of filter paper or clear cotton gauze can be used to soak up some blood and then air dried. So for doing blood grouping and also for doing DNA fingerprinting or DNA profiling, a piece of filter paper or a clean cotton gauze can be used to soak up some blood from the deceased person, and it should be air dried and supplied to the chemical examiner. And for blood, sodium fluoride is used as preservative along with potassium oxalate as anticoagulant. And formalin and denatured spirit should never be used in any case of poisoning. So there are some conditions where preservation is not necessary. That is, if the viscera can be analyzed within 24 hours by the chemical examiner, or if the sample can be kept in a refrigerator or ice box, and in case of bones, hair, nails, etc. And for lungs, for the detection of inhaled poison. In all these cases, preservation is not necessary. This is the picture of sodium fluoride, which is used as a preservative for blood. And there is a condition that if the prosector or the forensic pathologist destroys the viscera without the permission of the investigating officer, the prosector or the forensic expert is likely to be charged and punished under IPC section 201 for causing loss of evidence. Now about the instructions for the dispatch of viscera to the chemical examiner. That is, stomach and its contents, small intestines and its contents are preserved in one bottle, and liver and kidney in another bottle. So in the first two bottles, in the first bottle, stomach and its contents plus small intestine and its contents. In the second bottle, liver and kidney. And the blood and urine may be preserved separately in a 30 ml bottle. Then stomach and small intestine may be opened before they are preserved, because if we keep it closed, it may be subjected to putrefaction and air will be released. So it is to be cut open before preserving. Then the liver and kidneys are cut into small pieces of about 0.5 to 1 millimeter thickness. And as a rule, the 1/3 volume of the container is to be occupied by the viscera, 1/3 by the preservative, and 1/3 should be kept empty, as it will give some room for any gas evolving during putrefaction. So 1/3 of the container should be occupied by the viscera, 1/3 by the preservative, and 1/3 should be kept empty. Then the stopper of the glass bottle should be well fitting, and it should be covered with a piece of cloth and tied by tape or string, and the ends of the string should be sealed, and the bottles should be labeled accordingly: the name, sex, autopsy number, police station, crime number, organ that the bottle contains, then the date and place of autopsy, preservative used, and the signature of the autopsy surgeon. A sample of preservative used should be kept separately, and all the sealed bottles are put in a box which is locked, and the lock is sealed using personal or departmental seal. A copy of the inquest report plus the postmortem report plus the authorization from magistrate is sent to the state forensic laboratory along with the viscera. Then the key of the box and a sample of seal on a piece of paper corresponding to the seal that is used for sealing the bottles and lock are kept in an envelope which is sealed and sent with the viscera box. And the viscera box is handed over to the police constable after taking a receipt from the police constable, and this police constable will deliver it personally in the office of State Forensic Science Laboratory after obtaining a receipt for the same. Usually the box containing the bottles will not be sent by courier. It will be delivered personally by the police constable to the office of the State Forensic Science Laboratory. And if the contents in the viscera box are infectious, or it may contain radioactives, and if it is so, this should be communicated to the chemical examiner. In cases of poisoning, if we know the poisoning or if we suspect a particular poisoning, some special viscera are to be preserved along with the regular ones. In case of strychnine poisoning, digitalis, yellow leander, etc., heart should be preserved. If alkaloids, organophosphorus compounds, carbon monoxide, cyanide, strychnine, barbiturates, anesthetics, and volatile organic poisons are suspected, then brain is to be preserved. In case of strychnine and gelsemium, spinal cord is to be preserved. If we suspect the presence of alcohol, we have to preserve cerebrospinal fluid. If narcotic drugs, cocaine, methadone, barbiturate, etc., are suspected, then bile is to be preserved. Alcohol, chloroform, cocaine, morphine, etc., can be identified from the vitreous humor, so it has to be preserved. Then, if we suspect the presence of gaseous poisons, hydrocyanic acid, alcohol, chloroform, etc., then lung is to be preserved. In case of insulin, morphine, heroin, cocaine, and other illicit drug poisoning, the area through which the poisons are injected, that part of skin should be preserved and sent to the State Forensic Science Laboratory. Then, in case of subacute or chronic poisoning by thallium, arsenic, antimony, radium, etc., bone has to be preserved. Then, in case of arsenic and other heavy metals, hair and nail should be preserved. And in case of criminal abortion, the uterus, the whole should be preserved and sent to the forensic science laboratory. And if the internal organs are badly putrefied, then some part of muscle tissue, about 3 by 3 centimeter or about 50 to 100 gram of muscle tissues, especially of the thigh, should be well preserved and be analyzed. And in case of embalmed body, there will be no viscera, or the viscera may be already undergone autopsy. Then the best specimen may be skeletal muscle from the buttocks. And in some cases, like poisoning with the pesticides and insecticides, 10 gram of abdominal wall fat or from perinephric region are to be preserved. Along with the viscera box, we have to send some information to the forensic science laboratory. That is about the brief details of the symptoms, if any, and the length of illness before death. Then, if poison taken is not known, the drug or poisons to which the deceased was known to have access, including medicines, are to be supplied. Then the history obtained from the family members and friends, postmortem interval before samples were obtained are to be informed. Then list of samples provided and sampling site for each and preservative used. Then the empty containers or medications which are found at crime scene, autopsy findings, and if there are any special risks with the samples, example, if it is infectious or if it is radioactive, this is to be informed to the State Forensic Science Laboratory. Then, after doing autopsy, we have to form opinion about the cause and manner of death, depending on the appearance observed. And the cause and manner of death should be given in vernacular language, and it should not be uh, delayed longer than 2 days. So within 2 days, we have to form an opinion about the cause and manner of death, and we have to give a copy of the opinion of our opinion to the investigating officer, and the other copy has to be kept for future reference. And for giving cause of death, the word probably should be avoided. And if the death is caused by poison, then the conclusion of death will depend on the clinical evaluation, then from the autopsy, from toxicological analysis, and from circumstantial evidence. Also, if the death was caused by poison, we have to wait for the arrival of toxicological analysis, because in case of poisoning, some portion of the poison has to be detected from the viscera by chemical examination. So Before giving our opinion on the cause of death, in case of poison, we have to wait for the arrival of toxicological analysis. And if opinion are to be given before the evaluation of the chemical analysis, then it should be clearly and unmistakably labeled as only preliminary impressions, which can be subject to change as and when the facts so warrant. So, if we are giving our opinion before the arrival of chemical examiner's report, then our opinion should be clearly and unmistakably labeled as preliminary impression, which can be subjected to change as and when the chemical examiner's report arrives. And it must be recognized that the determination of cause and matter of death are opinions, not facts. And in case the opinion has to be given, it should be is not or if the cause of death is not found on autopsy, or it is a negative autopsy, the opinion as to the cause of death should be given as undetermined or unascertained, and the manner of death will be given as unknown. Sometimes there can be obliteration of identity. So we have to collect all the data that will help uh, the identity of the person, of the deceased person. So obliteration of identity can be purposefully done to obscure the identity of the deceased person. Then it can be done by some animals after death, then by partial or complete burning or incineration of the body. There can be obliteration of identity. If the body is seen in a stage of advanced putrefaction, there is a chance for obliteration of identity. Then there can be dismemberment or burying or throwing different parts in different places. It can also lead to obliteration of identity. There can be some biocremation or chemical hydrolysis, which will lead to obliteration of identity. Also, there can be dismemberment by moving vehicles like a train or by machinery, etc. And also in case of bomb explosions, which will primarily disintegrate the body. So the circumstances where there is obliteration of identity. Now, we have to learn about a term called virtual autopsy. This will be the future of autopsy. And this is a non invasive technique of examining the dead bodies to find out the cause of death. So, there is no invasion or no incision on to be done on the body. And virtual autopsy or virchops is a combination of CT and MRI imaging, photogrammetry, and 3D optical measuring techniques. The computerized tomogram is used for finding out the morbid anatomical findings. And MRI is used to detect soft tissue injury, organ trauma, the state of blood vessel, tissue, and bone. Also, the 3D optical measuring technique can measure the weight of organs. Then also, this can be used for biopsy of organs to find out the presence of any chemicals or poisoning substances. Sometimes we have to do autopsy in a mutilated body. So in case of a mutilated body, we have to determine whether the mutilated body belongs to a human or not. Secondly, we have to fit the parts and form a structure. Sometimes the whole body part may be obtained. So we have to complete the body structure using the parts available. Then we have to write down the nature and character of the parts. How were they separated? Their manner of separation. Then we have to determine the sex from the mutilated parts. Then we have to estimate the probable age, and we have to collect all the data that will be helpful in the identification of the diseased person in future. Then we have to find out the probable time of death, and also we have to find out the probable cause of death. Another term we have to study is about forensic anthropology. So, this is a branch of physical anthropology in which it is used for forensic purposes, dealing with the identification and analysis of skeletonized remains known to be or suspected of being human. So, forensic anthropology is basically used for the identification and analysis of skeletonized remains. So, if we have to do an autopsy on skeletonized remains, we have to determine whether the remains or the skeletonized remains actually are bones or not. If they are bones, whether it belong to human or animals. And if it is a human skeletal remain, we have to identify whether it is of a single person or more than one person's involved. Then we have to estimate the sex from the data that are obtained from the skeleton, and we have to identify the age at which this person was died. Then we have to calculate the race, and we have to calculate the stature from the data that is obtained from the skeletal remains. Then further we have to collect data that will be helpful for the identification of the deceased person. Then whether there is any injury that is being evident in the skeletal remains, that is to be identified. Then if the bones are burnt, the manner by which it is burned, if any inflammable material used, then we have to calculate the time since death. That is mainly done by the carbon dating of the skeletal remains. Then finally we have to form an opinion about the cause of death also. The last topic for today is on exhumation. So, exhumation comes from two Latin words, that is ex and humus. Ex means out of, and humus means ground. So, exhumation means out of ground. Definition of exhumation goes like this. Exhumation means the authorized digging out of the coffin of a dead person from his grave. So it has to be done with the authorization from a magistrate, and it is permission for digging out the coffin of a dead person from his grave. The purpose for autopsy is to establish the cause of death or to decide upon some other relevant fact, such as the person's identity. This is a picture in which exhumation is being done. And exhumation is rarely done in India, because in India, bodies are mostly disposed of by cremation, that is by burning. But in some communities like Christians and then Muslims, and then some parts of India, Hindus also bury their body. So exhumation primarily belongs to the community in which the dead bodies are buried. And we have to differentiate exhumation versus retrieval. So, in case of exhumation, exhumation is done after a proper inhumation or after a ritual burial of the body in a legitimate and legal fashion. But retrieval of a body takes place after the body was inhumed in the first place, or it was never legally buried. So if the body was legally buried, then the term exhumation comes into place. And if the body was not legally buried, the term is called retrieval. So for exhumation, it can be done only by a magistrate under section 176 of Criminal Procedure Code. And but retrieval of an illegally buried body can be done even by the police under section 174 of CRPC. The reason for exhumation, uh, example for exhumation is given in Drishyam 2, because the body that was buried has to be uh, exhumed. So even it was not legally buried, the exhumation has to be undertaken by the magistrate. So it can also be called a retrieval. So the police will be giving the instructions for retrieval of the body. And if the body was buried legally, it will be basically exhumation. But in Drishyam 2 and in Drishyam 1, the exhumation of the or the retrieval of the body was done, and the body obtained was that of a calf. That is retrieval. Uh, so basically, exhumation is digging out of a body, authorized digging out of the body after it was uh, done by proper inhumation, and retrieval is by the digging out of a body which was never legally buried. What will be the reasons for exhumation? There can be three reasons: criminal, civil, and other reasons. The criminal reasons for exhumation include for establishing the cause of his death, or for retrieving some vital object which may throw more light onto the case, such as retrieving the bullet from the dead body if the person was killed by a firearm. The civil reasons for exhumation include identification of the deceased for various purposes, including the burial of a wrong body inadvertently or by fraud, or for settling of inheritance, etc. We are facing some cases of burial of wrong body of COVID victims these days. Some medical colleges are giving wrong body inadvertently for burial, and their relatives are raising issues on burial of wrong body. Then sometimes exhumation can be done for historical reasons, that is looking at nutrition and disease in case of previous generations, and for re-establishing the cause of death. Because, so if the person was died, and it was subjected to autopsy and the cause of death was found out, then for re-establishing that cause of death, we can dig out the body or exhumate the body and do an autopsy, and we have to re-establish the cause of death. And if the site of graveyard is to be moved to another part, that is for redevelopment, exhumation of bodies can be done. Then when the relatives wish to relocate the grave for some reason, this type of exhumation and reburial was done to our master Hanuman. Then some unusual reasons may be uh, for exhumation. Then some of the unusual reasons are to test the methods for preventing or slowing down the process of postmortem decay. Then exhumation for reburial, that is for emotional reasons. The example is that while the World War II, some innocent civilians were shot or killed and then buried in mass graves without coffins and even without the proper last rites. And after the war was over, many such bodies of the innocent civilians were exhumed and reburied with proper rites. And sometimes exhumation can also be ordered at the request of the family to recover an object placed inadvertently with the remains. Some indications for doing exhumations are suspicions of poisoning, then some allegations of foul play, criminal abortion, homicides, disputed cause of death, in case of insurance, then liability of malpractice for identification and for doing second postmortem. There are some rules that govern the process of exhumation. That is, a written order from the district magistrate or coroner has to be obtained, and the body can be exhumed only upon the written order from the first class magistrate, whether it is judicial or executive magistrate. And police cannot order exhumation, but they can do retrieval of the body. And the magistrate will constitute a board comprising of 3 different forensic pathologists from 3 different medical institutions. And this board of 3 different forensic pathologists jointly supervise exhumations and conducts post-mortem examination of the remains. And this process, that is exhumation, has to be conducted early in the morning and in broad daylight by the presence of the uh, panel of medical officers, in the presence of police officer or magistrate or coroner, and the site should be identified by the relatives and by the site manager. The coffin has to be identified, and before doing autopsy we have to screen of the area. Then in case of poisoning, the pound of earth that is in direct contact with the body should be collected. Soil from above, from below, from all 4 sides of the coffin should be collected and preserved in separate glass jars with identification tags of the location. And in addition, at least 2 samples must be taken from the distance, say about 25 to 30 yards from the grave. So a total of 8 specimens will be there: soil from above, below, and from all the 4 sides, and 2 samples from some distance. Then the body has to be identified, and the examination should be done in situ, and the exhumation should be done in the same manner as doing a postmortem on a decomposed body, and no use of disinfectants on the body are allowed. And we have to use mask which is dipped in potassium permanganate, then should stand on the windward side of the body. So this is a picture of an exhumed body, and if the body has been converted to skeletal remains, then the bones has to be boiled before examination, and this boiling or maceration will reveal diagnosis not available otherwise by ordinary examination, and this is not recommended. This is recommended not only in medical legal autopsies but also in historical material also. So we have to boil the bones before examination. This is another picture of an exhumed body. Then regarding the time frame, in India and in England, there is no time frame for doing exhumation. So so a magistrate can order exhumation at any time. And in France, there is a time limit of about 10 years, and in Germany, about 30 years. So the topics discussed in today's lecture include preservation and dispatch of viscera, determination of cause of death after doing autopsy, virtual autopsy or virtuopsy, the autopsy of skeletal remains, that is forensic anthropology, and finally, exhumation. So this concludes the lecture on autopsy. Thank you.